Okay, for our hip capsule or supported hip capsule stretch here, I'm just going to get into it just because there's a lot of things going on here and I want to try and keep this video as short as possible. So what we're going to do is start out with some sort of tabletop or box that's about hip height. This might be a little bit short for me, but you'll get the idea here. We want something to stand on here. So a 2x4, a plate in the gym, about 1 or 2 inches high, a book will work. Just make sure that your entire foot is on that surface. You're going to set up here in a staggered stance with your the toes of your left foot basically dissecting the right arch. So I'm just going to switch my feet here so you can see it. I'm setting up like that, but obviously switched around, okay? So right foot is slightly ahead of the left. All right, so in a moment here, I'm going to get down into this position. But before we do that, I want to make sure we set up the lower body. It's extremely important that we do so properly. Okay, so what I want to do is basically bend the knees slightly. I want you to push your right knee forward and pull your left hip back and just shift your weight. So like 90% of your weight is on this left side. You may actually shift and spill over a little bit. That's okay, I don't mind that. Once you have that position, what I want you to do is find the inside of this left foot. So again, because you're shifted over 90% of your weight, you probably have most of your weight on your heel, and that's okay. I'd rather have it on the heel than on your toes. Okay, well, I want you to kind of really sit into this back side. You're going to feel kind of a stretch here in this hip socket or back pocket area. But what I want you to do is focus on kind of your left knee here and pull it in towards your right knee, and that's going to kind of shift the weight to the inside edge of your left foot, okay? And when you do that, you should feel all the tissue on the inside of this leg kind of activate a little bit. Okay, those are more or less mostly your adductors. Okay, so once you're in that position and you have that, we're going to get down here with palms up. Now, normally for every drill I give you, I want to stack your thorax on top of your pelvis. For this drill, I want you to kind of tuck your tailbone or your hips underneath a little bit so you have a nice rounded spine. That's going to help get airflow into that area that we're looking to expand here, which is that kind of posterior hip here, okay? Palms are up. Now, there's one other thing here. We're going to do a lateral side bend and kind of crunch down on that left side or left oblique. So I'm just going to rotate around here really quickly so you can see that from the back view. Okay, so I'm set up here. Okay, I'm taking my left knee and I'm kind of pushing it in a little bit. That's going to activate the tissue on the inside of the leg. And then from here, I want just a slight left side bend here just to really get those left obliques on. Okay, so we'll save you the backside view. Get back into here. Okay, I'm back in this position here. Perfect. All right, so from here, once you have that, and I want you to check in with all those things, and I'll kind of remind you as we go through this. I want you to close your mouth, breathe in quietly through your nose, and really get a full 360-degree breath and expanding your rib cage in all directions. You should really feel more air kind of going this right side, but I do want you to kind of feel everything. Once you get that full inhale, I want you to open your mouth and get a full exhale twice as long. Remember, it's a big open mouth. You're trying to fog that window. Once you get to the end of your exhale, you're probably going to need to go a little bit more. It's going to be a little bit uncomfortable, but you're going to feel your obliques kick on, especially that left side because you're in that left side bend. Once you get that, I want to maintain that tension in the obliques. Close your mouth. Take another quiet breath in through your nose. Big open mouth exhale. We'll do one more, but just check in. Do you feel your left obliques? Is the majority of your weight on your left side? Is your left knee kicking in a little bit so you can feel the adductors and you can feel the weight on the inside of that left foot? Is your right knee pushing slightly forward? Okay. Once you have that, take your next breath in. So close the mouth, breathe into the nose. Big open mouth exhale. And that's your supported hip capsule stretch.